So Diana, welcome to the clinic today.
Thank you.
So today we're going to do a little bit of volume filling, like we talked about at one of the previous appointments when you were here. The part on your face, if you can just look straight forward there, the part on your face that we were going to address are these oral commissures right here. They kind of, as we start to lose volume and the face starts to come down, it makes us look like we're frowning. So we want to turn that back up, and of course one of the definitive ways to do it is through a lower facelift, which I do not do, but one thing that we do here, and that is probably becoming even more popular, is to do a filler through the commissures. And a product that I like to use is something called Radiesse. I do often use Restylane or Juvederm in those, but Radiesse is a very robust, thicker dermal filler, and it has very good longevity to it. So after we inject it, you can plan on that material staying in there for a good year. I've done a lot of syringes of Radiesse over the past 3-4 years, and it's just a very good product, very safe too.
Sounds good.
The nice thing about this product, Radiesse, is that we can now mix it with a little bit of local anesthetic of lidocaine so that the procedure becomes much more tolerable. Really, patients love this. So we put a little bit of lidocaine or local anesthetic in there, and then we mix it back and forth with the product several times. And it really does make the procedure quite tolerable to the patient, as you'll see. So now we are set with our one syringe of Radiesse, which is approximately 1.3 cc's, and we're ready to inject the patient. Okay, are you ready, Diana?
Yes.
So we just kind of cooled down that portion of the cheek a little bit. So this will start to get numb as we inject. Good. So we kind of go back and forth in a crisscrossing manner. It's actually pretty tolerable, isn't it? Before, when we used to have to inject this without any anesthesia, patients really did not like that at all.
That is so much better. That's incredible.
Good. I was sure that you would be able to tell a big difference from the previous time that you had it.
That's like night and day. That's amazing.
Good. And we'll go over to the other side here. You doing okay?
Oh yeah, this is great.
Yeah, in comparison, I mean,
Oh yeah.
to previous, I'd have to agree with you. Most of my patients say the same thing. I really appreciate that. The new patient comfort aspect of having that anesthetic. Now you hold a little pressure right there.
Yeah.
And it's a great product. Radiesse is a really nice product to work with. I still love Restylane and Juvederm as well. You don't have to hold a little pressure right there. But Radiesse is a bit different. As I said, it's more viscous, it has a lot better longevity, but there's different uses, and we use different fillers for different parts of the face. I use Radiesse when I need a lot of volume, when I have a larger fold, not for fine lines and wrinkles. For the finer lines and wrinkles and for lips, I prefer to use Restylane and Juvederm. Both excellent products, but again, used for different things. You can't shotgun approach adding volume to the face because we have different fillers for different reasons, and probably one of the most common questions that I get asked is, what are you going to use on me, Dr. Hall? What product are you going to use? Well, most doctors will tell you that we use different things for different areas, and we just fortunately have some really nice fillers right now to use in the United States that are approved. Not too bad.
No, that was wonderful.
Good. And you can see, from the beginning to the end, what a huge change that makes, just giving her a little added volume in those commissures. And she'll have a little bit of swelling and inflammation and for the next 24 hours, but it'll be red for the rest of the day. And tomorrow she'll be able to go about her normal activities, maybe a little foundation or cover-up, concealer if she has some bruising, but she'll be able to go about her daily activities.